G'day everyone, Dr. Amelia Fraser here. Now I know what you're thinking. A woman talking about men's beds? But hear me out, mate. I've been practicing urology here in Auckland for over 15 years, and I reckon I've seen just about everything when it comes to the prostate. Today, we're tackling a topic that plenty of blokes find a bit awkward to discuss. What actually happens to your prostate when you masturbate regularly? And look, before anyone clicks away feeling embarrassed, let me tell you something. In my clinic, I've had thousands of conversations about this topic. It's completely normal, it's completely natural, and honestly, it's about time we had a proper yarn about it, without all the shame and nonsense. So here's the thing that got me keen to make this video. I had a patient come in last week. Lovely fella, been married for 30-odd years. And he asked me straight up whether masturbating daily was going to wreck his prostate. He'd read all sorts of rubbish online, and the poor bloke was genuinely worried. And that's when I thought, right, we need to sort this out once and for all. Because there's so much misinformation floating around, and you fellas deserve to know the actual facts, based on real science, not some nonsense your mate Dave reckons he read somewhere. Let me start by giving you a quick rundown on what your prostate actually does, because I find heaps of men don't really understand this little gland. Your prostate is about the size of a walnut, sits just below your bladder, and wraps around your urethra. That's the tube your wee comes through. Now, its main job is producing seminal fluid, which makes up about 70% of your ejaculate. This fluid protects and nourishes sperm, giving them the best chance of doing their job. So every time you ejaculate, whether that's through sex or masturbation, your prostate is working hard, contracting and releasing fluid. It's a pretty clever little organ when you think about it. Now, let's get into what happens when masturbation becomes a regular thing. And by regular, I mean daily or near daily. The first thing I want to talk about is how your prostate actually adapts and improves its function. You see, when you're ejaculating regularly, your prostate goes through a consistent cycle of producing and secreting fluid. This constant stimulation can actually lead to what we call an adaptive response. Your prostate essentially becomes more efficient at its job. It's a bit like going to the gym regularly. The more you use a muscle, the better it performs, within reason, of course. This increased activity is generally not harmful. In fact, I've seen plenty of evidence in my practice that suggests it can be beneficial. However, there can be some physical effects. With frequent stimulation, you might notice a temporary enlargement of the prostate. Now, don't panic. This is completely normal and usually harmless. Some men describe it as a feeling of fullness or slight pressure in the pelvic area, especially if they're not giving the gland enough time to recover between sessions. Over time, this cycle of increased activity and recovery becomes the new normal for your prostate, and it adapts accordingly. The second thing I want to cover is what we call temporary swelling and blood flow changes. During arousal and ejaculation, blood flow to your pelvic region increases significantly, and that includes your prostate. This increased blood flow causes the gland to swell slightly, which is a completely natural response to heightened activity. After ejaculation, your prostate doesn't immediately snap back to its pre-arousal state. The process of reducing blood flow and releasing built-up tension takes some time, leading to a period of continued swelling. For blokes who masturbate daily, this swelling might not even be noticeable, but it does indicate that your prostate is actively involved during sexual activity. These repeated cycles of swelling and relaxation can make the prostate more sensitive over time. Some men might experience a mild throbbing in the pelvic area or a sense of fullness after ejaculation. While this isn't harmful in itself, it's important to pay attention to these sensations. If swelling becomes persistent or painful, it could indicate an underlying condition like inflammation or irritation that needs medical attention. So if something feels off, don't be a tough guy about it. Come see someone like me, yeah? Now, here's something that might surprise you, and this is actually one of the genuine benefits of regular ejaculation. It improves what we call prostatic drainage. Think of your prostate like a tank that's constantly producing fluid. Ejaculation is the natural way for this gland to expel what it's made. Without regular ejaculation, these fluids can accumulate, potentially leading to discomfort or even an increased risk of infection. By emptying the prostate regularly, men help maintain the gland's hygiene and reduce the risk of conditions like prostatitis. That's inflammation of the prostate, which can cause pain, urinary complications, and sometimes fever. And here's where it gets really interesting. Research has suggested that regular ejaculation may reduce the risk of prostate cancer. A major study from Harvard followed about 30,000 men over 18 years, and they found that blokes who ejaculated 21 times or more per month had a significantly lower risk of prostate cancer compared to those who ejaculated 4 to 7 times monthly. The theory is that regular ejaculation helps flush out toxins and potentially harmful compounds that might otherwise accumulate in the gland. Now, I'm not saying you need to hit that number, everyone's different, but the evidence does suggest that regular sexual activity, whether with a partner or solo, can have protective effects. However, and this is important, there's a balance to be maintained. While regular drainage is beneficial, excessive practice could put unnecessary strain on the prostate. The continuous production and secretion of fluids without adequate recovery time can lead to fatigue and even mild inflammation over time. Good hydration and a diet rich in prostate-friendly nutrients like zinc, vitamin D, and omega-3 fatty acids can support gland health, particularly for men who are sexually active regularly. Here in New Zealand, we're lucky to have access to fantastic seafood, salmon, mussels, oysters, which are brilliant for prostate health. So load up on those green-lipped mussels, fellas. Right, let's talk about something I get asked about heaps. Hormones. Daily masturbation doesn't just have physical effects on your prostate. It also influences the hormonal environment around the gland. Your prostate is particularly sensitive to male hormones like testosterone and its more potent derivative, dihydrotestosterone, or DHT. These hormones regulate the growth and functionality of your prostate, and frequent ejaculation can gently influence their balance. When masturbation becomes a daily practice, your body adapts by fine-tuning its hormonal mechanisms. This can lead to changes in seminal fluid production as the prostate and seminal vesicles work to keep up with demand. Some men might notice changes in the consistency or volume of their ejaculate, which reflects fluctuations in gland activity and hormone balance. Over time, these hormonal shifts can also affect prostate sensitivity. Some blokes might experience more intense orgasms, while others might feel less pleasure due to heightened gland activity. Additionally, repeated ejaculation can cause a temporary dip in testosterone levels as your body works to replenish its hormonal reserves. While these changes are generally minor and reversible, they highlight the need for balance. Maintaining optimal hormonal health through proper nutrition, regular exercise, and effective stress management helps support prostate health and functionality, even with frequent use. And look, I know we Kiwi blokes aren't always the best at managing stress, but trust me, it makes a real difference to your overall health, including down there. Now, I want to address something that comes up in my clinic pretty regularly. The concern about prolonged recovery time and what I sometimes call prostate fatigue. For men who masturbate daily, the prostate and surrounding structures go through a cycle of constant stimulation and recovery. While your prostate is remarkably adaptable, sustained stress can lead to a state of exhaustion. This doesn't happen suddenly. It develops gradually as the repetitive cycle of fluid production, swelling during arousal, and contraction during ejaculation takes its toll. One of the main indicators of this exhaustion is a longer recovery period after ejaculation. Men might notice that their orgasms feel less intense or less satisfying, suggesting that the prostate and pelvic muscles aren't fully recovering between ejaculations. Additionally, a feeling of dull aching or mild discomfort in the pelvic area, especially after multiple sessions, might become more pronounced. This fatigue can also affect urinary habits. Because your prostate surrounds the urethra, any mild irritation or inflammation can cause temporary changes in urine flow, including a weaker stream or increased urgency. While these symptoms often resolve on their own with rest, they emphasize that your prostate, like any other organ in your body, needs to be treated in moderation.
To ease this fatigue, men might consider incorporating rest days into their routine, allowing the prostate to fully recover. Good hydration and a diet rich in anti-inflammatory nutrients, particularly omega-3 fatty acids, as well as zinc and vitamin E, can contribute to the gland's health and resilience. Sweet as, just give your body a break now and then, and you'll be right. Another effect of daily masturbation that I need to mention is the possibility of mild irritation or inflammation of the prostate, especially if the activity is intense or prolonged. During ejaculation, your prostate contracts forcefully to release seminal fluid. Frequent repetition of this action can lead to increased sensitivity or irritation of the gland. Prostate irritation can manifest in various ways. Some men might experience a persistent feeling of fullness or discomfort in the lower abdomen or perineum. That's the area between your scrotum and anus.
Others might notice a mild burning or tingling sensation after ejaculation, which could indicate possible overstimulation of the gland. In some cases, this irritation can develop into prostatitis, an inflammation of the gland that can lead to more serious symptoms, like pelvic discomfort, difficulty urinating, or fever. While prostatitis is primarily associated with bacterial infections, non-bacterial variants of the condition can sometimes be linked to lifestyle factors, including excessive prostatic stimulation. To reduce the risk of irritation, it's essential to practice with care. Adequate lubrication, avoiding overly forceful methods, and allowing recovery time for the gland can help protect your prostate from excessive stress. If discomfort persists or worsens, it's crucial to see a doctor to rule out any underlying conditions. And honestly, I can't stress this enough. If something doesn't feel right, get it checked out. We're not here to judge you, we're here to help. Now, I want to take a moment to bust some myths, because I hear some absolute rubbish in my clinic sometimes. First up, no, masturbation does not make you go blind. I don't know where this one started, probably some Victorian-era nonsense, but there is absolutely zero scientific evidence linking masturbation to vision problems. Your eyes are completely safe, I promise you. Second myth. Masturbation does not damage your spinal cord or cause back problems. Again, no evidence whatsoever. Your spine is doing just fine. If you've got back pain, it's probably because you've been sitting in front of the telly for too long or need to work on your posture, not because of what you're doing in private. Third myth. And this is one I heard from an older patient just last month. The idea that men have a limited number of ejaculations in their lifetime, like you've got some kind of quota. Complete nonsense. Your body continuously produces sperm and seminal fluid throughout your life. There's no counter-ticking down. And finally, masturbation does not cause infertility. In fact, for some men, regular ejaculation can actually improve sperm quality by ensuring fresher sperm are available. So please, ignore all that rubbish you might have heard growing up. Let's focus on what the science actually tells us. One question I get asked fairly often is whether there's a difference between masturbation and partnered sex when it comes to prostate health. It's a fair question. The short answer is that from a purely physiological standpoint, your prostate doesn't really distinguish between the two. Ejaculation is ejaculation, and the gland goes through the same process, regardless of how you achieved it. The benefits of regular prostatic drainage apply whether you're with a partner or flying solo. That said, there can be some differences in intensity and frequency. Partnered sex might involve longer arousal periods and potentially more intense orgasms for some men, which could affect the prostate slightly differently. But in terms of the key benefits we've discussed, improved drainage, potential cancer risk reduction, maintaining gland function, both activities provide similar outcomes. So if you're in a relationship with less frequent sex, or if you're single, don't worry. Taking matters into your own hands is doing your prostate just as much good. Now, let's talk about what happens in the long term. Considering the lasting impacts of daily masturbation on prostate health is important. As I mentioned earlier, regular ejaculation has been linked to a reduced risk of prostate cancer, and this is one of the most significant long-term benefits. This protective function relies on the prostate's ability to expel harmful compounds, including potential carcinogens, through repeated ejaculations. Studies show that men who ejaculate frequently, whether through intercourse or masturbation, have a lower risk of developing prostate cancer over their lifetime. However, the benefits of regular ejaculation must be weighed against the potential risks of excessive practice. For men with pre-existing conditions like benign prostatic hyperplasia or BPH, or chronic prostatitis, regular masturbation might aggravate symptoms, including urinary issues or pelvic discomfort. Additionally, the accumulated strain on the gland over time could lead to chronic inflammation or heightened sensitivity. To maximize benefits while limiting risks, individuals need to adopt a balanced approach. Listening to your body's signals, incorporating rest periods, and consulting health professionals when needed can help maintain prostate health and strength. I also want to address a concern that came up from one of my patients recently. He was 55, had been married for over 30 years, and due to a serious illness affecting his breathing, hadn't had any sexual activity, not with his wife, not on his own, for about 5 years. He came to me worried because his PSA levels had suddenly spiked, and his prostate was enlarged and hardened. He asked me directly, could 5 years of abstinence have caused this? It's a complicated question, and I want to be honest with you. While we can't definitively say that abstinence caused his issues, there is some evidence suggesting that regular ejaculation helps maintain prostate health. The lack of regular drainage might have contributed to fluid accumulation and potentially inflammation. However, other factors like age, genetics, overall health, and his underlying lung condition could all play a role. The takeaway here isn't to panic if you've been abstinent for a while, but rather to understand that regular prostate activity, when possible, may be beneficial. And if you notice any changes, difficulty urinating, pelvic pain, changes in ejaculation, please get checked out promptly. Another patient asked me whether prostatitis, inflammation of the prostate, can develop into cancer. He'd had 2 biopsies, both showing inflammation, but thankfully no tumour. This is a really important question. The relationship between chronic inflammation and cancer is complex. While chronic prostatitis itself doesn't directly turn into cancer, long-term inflammation anywhere in the body can potentially increase cancer risk over time. That's why managing prostatitis effectively is so important. If you've been diagnosed with prostatitis, follow your treatment plan, maintain good hydration, and consider dietary changes that reduce inflammation. Regular monitoring through PSA tests and checkups with your urologist is also crucial. Right, let me wrap this up with some practical advice. Your prostate is a remarkable organ that can handle the demands of regular ejaculation while playing an essential role in your reproductive health. Daily masturbation can have benefits like improved drainage and potentially reduced cancer risk. But it can also cause issues like discomfort, sensitivity, or fatigue, if not well moderated. Maintaining a healthy prostate requires more than just moderation in sexual activity. A nutrient-rich diet featuring zinc, selenium, and omega-3 fatty acids can enhance gland function. Here in New Zealand, we've got access to some of the best seafood in the world. Make the most of it. Regular exercise and staying well hydrated support overall well-being too. Equally important is heeding the signals your body sends you. Discomfort, changes in urinary habits, or diminished intimate satisfaction shouldn't be ignored. If you found this video helpful and you're keen to explore other topics related to men's health, don't forget to give it a like, share it with a mate who might benefit, and subscribe to the channel. Your support helps me create more comprehensive and useful content that encourages you to manage your health effectively. I know it can feel awkward talking about this stuff, but honestly, the more we discuss it openly, the better off we'll all be. Until next time, take care of yourselves, listen to your bodies, and prioritize your health. She'll be right, as long as you're paying attention. Cheers, everyone.